Hello, everyone. It's Wednesday, October the 14th. We have 6 additional deaths to report to you since Monday. Again, this is 6 more too many. We're at 391 total deaths in West Virginia. It compares to the other states as a fabulous number. But if you think 391 people have perished because of this pandemic, it is an enormous number to think of it in the ways we should think of it. Our 386th death is an 84-year-old male from Cabell County. Our 387th death, an 85-year-old male from Kanawha County. Our 388th death, an 83-year-old male from Berkeley County. Our 389th death, a 73-year-old male from Kanawha County. Our 390th death, a 94-year-old male from Kanawha County. And our 391st death, a 67-year-old male from Summers County. Again, look at the ages. 67, I think of as a very, very young man. But from the standpoint of 67 all the way up to 94, we see clearly again who this terrible pandemic and terrible disease prey on the most. And so from that, absolutely, we have got to be concerned, especially for our elderly. Please don't let these people become a statistic. I say it all the time. Please keep their loved ones and all their family in your thoughts and your prayers. And some way let them know through your prayers that you're with them and they're not alone and they're appreciated. We will beat this thing, but I surely understand it's tough stuff. We've had 263 positive cases in the last 24 hours. Our daily positivity rate is at 4.21, and that's way too high. Our cumulative positive has now gotten up to 2.81. We have 4,612 active cases. We have 13,815 that have recovered. Our RT rate is at 0.95. It's the 7th best in the country. We have one county in red, that's Doddridge County on our map. We have five counties in orange, that's Marshall, Berkeley, Randolph, Nicholas, and Mingo counties. You can see this changes, and it changes pretty rapidly. The more you test, the more we'll know. The more you test, the more knowledge that we'll have. The more you test, the more spreaders we'll find to stop this. The more you test, the more lives we'll save. There is no question about it, period. Absolutely. I heard, on one of the broadcasts this morning, for people that are out there in the wilderness that are saying, oh, we shouldn't wear masks, we don't need to wear a mask and everything else, the commentator said, they're probably the very people that still think the world's flat. I don't want to be critical to those, but if the same thought is out there that says, well, all this testing that's going on and everything, we don't necessarily need to do the testing. Really, all that we're really trying to do with the testing is either get us back in school or get us to be able to play a football game, which is preposterous, totally preposterous. What we're trying to do with the testing is exactly what we've been able to achieve, and that is find the spreaders. Find those that are asymptomatic that we can do something about. We know of people that, this disease attacks everyone. It doesn't matter really if you're black or white or rich or poor or union or non-union, Democrat, Republican. For crying out loud, this thing sneaks in everywhere. So why not be tested? It takes almost no time. It absolutely may save another life. Absolutely, it will save lives, but it may be you that is truly saving another life. So please go get tested. Free testing will be available. It's up on our website. Today we'll be in Doddridge County, which is red. Today we'll be in Marshall, Berkeley, Randolph, Nicholas, and Mingo counties because they are orange. We will continue to offer free testing. We're continually trying to expand our testing, whether it be with the pharmacies that have stepped up or whether it be with adding additional teams with our National Guard. We're trying in every way to expand the testing. From Walgreens and Fruth pharmacies, they are doing great drive-through, testing at different locations. All this is helping. All this is up. In some way, somehow, we're going to put an end to this virus and everything, and we're going to win this deal. West Virginia is tied for 14th in the nation as far as our testing. I'd love to see us tied for first. We are higher than Ohio, Pennsylvania, Virginia, and Maryland. We absolutely need to continue to test and test and test and test. And right now, Kentucky is higher than us in the number in their testing that they've done. We have outbreaks 18 active outbreaks now in our school systems and 50 confirmed cases in the public school system. This was a number that was supplied to me a couple days ago. I want to just go over this just a second, and I could be a little skewed or a little wrong here. But the numbers that came to me from the Department of Ed and Public Health and different places were that, and this goes to show, how maybe we can think of things maybe not necessarily in the right way. But I think this is correct that we had a total number of outbreaks of our staff, our teachers, service personnel, whatever it may be, of 122 outbreaks. 122 of our staff, that were positive, and And in that, we had a total of 39,074 grand total number of employees, service personnel and teachers, that were involved. So if you take that and make that into a factor, you have 122 positives, and you got 39,074 people that are involved. And so what that comes back to, if I remember correctly, is a number that's like it becomes like a third of 1%. It's a little less than that. A third of 1%. Now just think about it. We're looking at numbers that are daily positivity rate of 4.8 or whatever it may be, or 3.2. We're talking a third of 1%. So in all honesty, as far as the numbers that we're coming up with as far as spreading or whatever at our schools from our staff or our service personnel, it's very, very, very minimal, very minimal. On top of that, if you look at the total number of students that are there, I think that number is somewhere around 209,000. I think that's the right number. Now I'm doing all this from memory. I don't have notes on any of this, but I think it's 209,019 or some number. Well, it may have been 209,955, but it was 209,000. And of that, we had 49 positive tests. 49 positive tests that have been reported to me. Now get this. That number becomes a fourth of 1/100%. Now just think, a fourth of 1/100%. That number becomes really 0.00023. So, in all honesty, at least for the moment, now we know this is fluid, and we know we want our schools to be super safe, super safe. I mean, really and truly, we continue in every single way, to tell you numbers, and these are numbers from the Department of Ed and DHHR, the numbers that we have to the best of our abilities right now. We're telling you first and foremost that we're trying with all in us to make the school the safest place that we can be for our teachers, our service personnel, our kids. For crying out loud, nobody wants to do anything to endanger our children. But if you look at it and you look at it fairly and you look at it mathematically, you would think that if a 1/100% is the number of positive kids that we have in our school system, really and truly today, it is one doggone safe spot to be. So, with all that being said, we need to just keep up and keep up and keep up until we come to a situation to where we have zero positive tests at our schools. That's what we want more than anything. I don't know how that we make it absolutely perfect, but as we continue to go on and on, we continue to ask our medical team and our medical experts to guide us. You heard Dr. Marsh talk the last time we were here. He said on a national level and on a state level, how absolutely good things were going at school and everything, and the schools that at where we stood at that time, the safety level and everything was terrific. We got to listen to our experts. I'm not that. I'm not a medical expert. I'm not an educational expert. I am your governor, and I will absolutely look at everything that comes down the pike, and I will listen to those experts. But I'm telling you, with the numbers that we have at our schools and everything right now, it's good numbers. Our long-term care facilities, we have 43 outbreaks there. We have 14 outbreaks in our churches in 11 counties. That's Doddridge, Fayette, Harrison, Logan, Mason, Nicholas, Putnam, Tucker, Upshur, Wayne, and Wood counties. We want to continue to, like I've said over and over, and follow the guidelines, pew in between you, wear your mask, wear your mask, wear your mask, and absolutely just continue to do all the proper hygiene things. Wash your hands, whatever, but please, just remember these numbers. Every day that I'm here, I read to you numbers of elderly people that we've lost. You know, there are those that would believe, well, you know, those people are old and they've had their life and everything else, but just think just this. Just think of the knowledge that they have. Just think of the wisdom that they have. And think of how that is passed on to all of us. And think how much that'll be missed. Think of the opportunities that we're losing every time we lose one of these people. So with all that, we've got to save them, don't we? They're our resource. They're the ones that have been through all the hard licks. They're the ones that know how to do things where they can teach us how to do them. So anyway, we've got to protect them. Please, if you happen to be one of those that are of that age, know that you're at risk. And absolutely know that maybe what you should do is think about getting your church services online or whatever it may be. If you choose to go, just protect yourself. Protect yourself in every way you possibly can. Corrections, we're down to 4 cases. I think that's what we had the other day, but we've got 1 at Mount Olive, 1 at North Central, 1 at Martinsburg, and 1 at Lori Yeager. We have 12 staff cases, you know, that are positive. I encourage you over and over and over to go get your flu shot. That'll help you in many, many ways. At our veterans nursing home, we have now tested all of the veterans that are at the nursing home in Clarksburg. We have no residents that have tested positive. There are 4 positive tests among the staff members. 2 of the staff members are nurses, and we're getting ready to do another round of testing, which begins today. From a standpoint of our Mon County bars, you know, we, by executive order, we reopened those bars on Tuesday. We expect them very much to be following these guidelines. ABCA will be working in coordination with the state and local police to increase the enforcement operations there. And failure, and I don't mean this in a threatening way, I am only saying that we have got to do it right, but failure to adhere to the guidelines and these supplemental protocols will result in suspension of a restaurant's or a bar's license to operate. So please, please, please work with us on the guidelines. We'll work with you. We know it can't be perfect and everything, but we know it can be a whole lot better than it was before. We've got out $147,402,000 now that have been awarded to our cities and our counties. All good stuff. You know, we encourage you to continue to apply. Right now we're at 99.9 on our census, which is outstanding beyond belief. Our unemployment rate continues to decline. It decreased to 8.6% in September. It's down 0.3% from the previous month. September marks the 5th consecutive month of improving unemployment numbers in West Virginia. The number of unemployed in our state the state has decreased by 2,700 people. That's good. We've still got a long ways to go to get back down in those 5s or lower as far as the percentages and everything, but West Virginia, you continue to do good stuff and everything. And for those that are still out and seeking employment and have lost their jobs because of this terrible pandemic, we won't forget you. And we'll try any and every way we possibly can to continue to try to help. And I truly believe that you'll continue to see assistance from us. I know you will, as well as the federal government. Our food bank money, this is something that we passed in our legislature, in our budget the last go round. We passed $1 million that would probably be going out to our food banks. Our food banks, our two primary food banks, the Mountaineer Food Bank and the Facing Hunger Food Bank, they need the funds and need the funds now. Naturally, there's been a run on our food banks and everything through this tough time and everything. And so now we're dispensing that money out to them. And here's the check that's going out. $1 million is going to the Mountaineer Food Bank and the Facing Hunger Food Bank. 500 each are going to these, and this is the money that the legislature was kind enough to pass, and I signed it. This is the money that we outlined in my State of the State. We're really happy to do this and everything. These people are doing phenomenal work, and we don't want anybody in West Virginia going hungry. I mean, for crying out loud, that's the least in the world that we can do, especially in a situation to where we have a prosperous economy and a good and positive outlook in the future. So we want to continue to help. And honest to Pete, if we can't take care of our people from the standpoint we've got people going hungry, then we're not much. And so we're going to do it, and we're going to get it done. From the standpoint of our charts, you can see, if you'll look at these real quick, our recovered and the top chart, our active cases and our recovered, it's really moving in a decent manner and everything. We'd like it to get wider and wider, but it's doing okay. If you look down, the biggest concern is just this. We had dropped down to 2 point something the other day on our daily positivity in the center chart and everything. And look at that little bounce up, back up and everything. We got to get that down. We just got to get that down. That's so important. And if you'll watch how we're trending on this cumulative, positivity, chart at 2.81. That's as high as it's been really in a long time. And so if you'll trace that back, you can go all the way back to sometime probably in May. And so, it's still good. It's still a number that, for the most part, any state, it'd be the envy of any state. We want to keep it below 3%. It's at 2.81. It's a long, long ways to 3%, and so it's good. But we just want that to start really trending and going down the other way. The national average, to give you an idea, the national average is somewhere, I think, a little over 5%. We're at 2.81. We're half of the national average, and it's good. Like I said, it's good. But we needed to start curving back down and trending back down the other way. But that's all I got today. I continue to just say one thing. If there's anything in the world that we have come upon in all of our efforts, it's one thing. It is just one giant thing. And that is test and test and test. It doesn't mean try to, scam the system and go get tested over and over and over yourself. It's test and test and test everybody. Just go get one test. It is so important to us. So important. It'll lead to a lot of goodness and, but nevertheless, that's all I got today.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus.
Well, good afternoon. I want to reinforce what the governor has said, that, while West Virginia is in many ways the envy of many states in America, we have also seen the spread of COVID-19 like every other state has. And as has been now communicated pretty widely in the lay press, the United States is starting to see a rise in the number of daily COVID positive people, starting to see a rise in hospitalizations, and that generally portends a rise in number of deaths. And so as we look at West Virginia, we know that our number of cases has still gone up despite us doing a real good job. And we're starting to see the number of hospitalizations go up in parts of our state. And that gives us a little bit of pause. And as we have, seen the governor every day reads the number of people that have died, and we see the rate of death of West Virginians, while it's slowed down a bit, maybe several days ago, seems like that's picking up a little bit as well. Our RT level, which was second lowest in the country, has started to rise a little bit again as well. And so I think that as we go forward, we know that it is extremely important, as the governor really encouraged us, to show up and get tested, particularly show up and get tested in counties where we see the spread go up. Dr. Amjad and I today had the real treat of talking with Emily Oster, who was the author as an economist at Brown and was the author of the Atlantic article about the rate of spread in children. And what Dr. Oster said, which is something that we have been really saying almost every day, that the risk of spreading in schools is directly related to the amount of disease that you have in your community. Because most people, as the governor said, bring the disease from the community into the school, whether it's staff or whether it's teachers or even whether it's students. And a study that we've talked about, the largest epidemiology study and contact tracing study so far in COVID, which happened in 2 villages in India and published in the journal Science, demonstrated that children can catch COVID as well. Children tend to spread COVID to other children, that the rate of transmission in houses was lower than the studies in China. It's about 9% versus 14, 17% we saw in China. So that means that even though children can get COVID and spread it, they don't spread it really effectively to other family members. They appear to be important in infecting other children. But it also brings up this really important issue. And this is almost like Groundhog Day, but there is a theory in all of science. It's called Occam's razor. And it was named for a historical person who said in a number of solutions to a problem, the simplest one is usually the right one. And we have talked about the power that we all have to start to slow COVID spread. And we're seeing COVID spread pick up around the country, and we're seeing COVID spread pick up around West Virginia. And the answer is wear your mask and physically distance and wash your hands and cover your cough and stay inside if you're sick and avoid the 3 C's: crowds, closed indoor spaces, close constant contact with people you don't live with. These are really effective strategies. So as we learn from India, children can get COVID, but as we've learned from the work that's been done in the US, if you are in properly, mask wearing and if possible distanced environments like classrooms, we don't see much spread there. And so it really says that if we are careful, and in fact, the CDC director Redfield noted that small family gatherings seem to be the lighter fluid that is igniting the current surge in number of COVID cases. So people are getting tired, but West Virginia, it is so important for us to keep up our commitment, our service, our altruism to each other, and make sure that we are protecting ourselves and that therefore protecting each other. Because the last thing I'll say is that we now have documented cases in the US and around the world where people have gotten reinfected with COVID-19. So the immunity, although in some people seems to last for a while, may not be perpetual, may not be forever. And for a few of the people that have gotten COVID again, they've actually gotten sicker the second time than they were the first time. So this idea that everybody should get it and, it's okay and no problems is something that we're actually not seeing, at least in some people. So it's so important, particularly as the flu season's coming up in the winter and we'll be inside more, that we really do pay even more attention to protecting ourselves and using the power that we have to slow and stop the spread of COVID-19. And if we keep our community safe and we get tested and we identify those few people that can spread to a whole bunch of others, which India found as well, then we can make our community safe, we can save lives, back in school, do the things we love to do and do it safely, and show the world what a great place West Virginia is to come to, because we can be leaders here. So thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard continues to stay focused on supporting testing initiatives as well as sanitization efforts. Just to highlight a couple of activities, we just completed with Department of Corrections the Mount Olive facility. The Guard supporting corrections sanitized 4 million cubic square feet of space at Mount Olive Prison in an attempt to continue to reduce the spread and mitigate virus in that facility. Continue to work significantly with DHHR to support local health departments. Right now, National Guard personnel are supporting 6 local health departments with surge capability as they manage the virus within staff and other activities within those operations. And as the governor pointed out, we continue to surge testing support. We are now 16th in the country based on number of individuals tested per 1,000 individuals in the population. Thank you.
All right, thank you, General. Dr. Ayn Amjad, our State Health Officer, and Bill Crouch, Secretary of the West Virginia DHHR, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers here. This is probably more of a question for Dr. Marsh, particularly when it comes to talking about these issues about schools and infection rates. And I've been pretty familiar with the Brown University school dashboard for a couple weeks. Now that we have a few weeks under our belt that we've had the gold color, we've now had both the infection number, we've now used the positivity number. Now that we've had the system now for a couple weeks, how do we feel about it? Do we see any other tweaks coming? Do we feel like we are capturing outbreaks or potential outbreaks in schools before they happen? As you've noted, a lot of these outbreaks are, and infections are coming from outside through the community versus inside the schools. Where do we stand on how that's doing, especially since obviously it's come under fire recently, but with a couple weeks under our belts, I assume we have some data to show that whether this is working the way we intended. Thank you.
Dr. Marsh, please.
Governor, are you ready? Okay. So thanks, Steve, for the question. We are really focused on having our approach strategically reach a few outcome measures. And I think that the tweaks that we've made have made a difference. The outcome measures we're really trying to focus on is we're trying to test more people. And as we've said, identify that small number of people. And that goes anywhere between 5 and 10% of people infected with COVID. And all of the studies that have been done tend to infect 60 to 80% of all other people infected with COVID. And these people have clusters, numbers of people that all get infected, much like we've talked about the choir practice at Washington State, where a 2-hour choir practice resulted in 56 of 62 people being infected, or a person in South Korea who attended 2 mega church events that one person led to the infection of about 5,000 other people. So we're really trying to identify and isolate these people. And oftentimes these people spread before they even know that they have COVID. They have no symptoms. They're pre-symptomatic in that 2.5 day window before symptoms start. And really the day of symptoms tend to be the highest infectious point in COVID spread. So I think that we want more people to get tested, and we've seen that, which is good. We want to try to reduce the number of people dying from COVID-19. And that's something that initially it looked like we were seeing that, and now perhaps that's sort of picked back up again. And again, this is what we're seeing around the rest of the country as well, but it is concerning. And we are also noticing more people appear to be hospitalized, and that's concerning for us. And we want to identify those super spreaders so that we can try to reduce that activity. And then the other thing is we want to see our RT values, our reproductive numbers, come down. And on the RT Live site, we did see that initially. And of course, we want to make sure that we are protecting our communities so it's safe for the people in those communities, not just to go to school, but to use the businesses in those communities and make sure that, that we are doing the right things so that those communities can function in a optimal way. And I think that certainly as we've added the percent positive rate to the infection rate or the incidence rate, we have seen a big bump up in the number of tests that we've done, still not as many as we want to see. And we have seen in general, the RT values have gone in the right direction, have really lowered from worst in the country to second best in the country earlier or late last week. And so, yes, I think that we're doing well so far, but we can't let our guard down. And testing is part of the strategy, but it is really up to everybody in West Virginia, teachers and staff and students and parents included, every citizen, that we want to take very seriously the measures that we can take to reduce the spread. And we know if 90% of people wear masks, we have basically, and physically distance, we basically have a vaccine already with us. And that is within all of our abilities to do. And remember, the key is that small family gatherings appear to be really important in the spread nationally. And with the holidays coming up and people being inside together, be really, really thoughtful about how you plan the rest of the fall and the winter, because this is a particularly challenging time, I think, for all of us.
All right, thank you, Steve. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I want to follow up on what I asked earlier this week about the possibility, at least theoretically, that the state would have to step in if some counties' response does not match what the state has mandated or what the state would prefer that a county is doing, particularly among school boards or school systems. Dr. Marsh answered it from a medical standpoint. That's the reason I asked him about it, because Governor, you've said that the medical team is leading the way, but he said that's really out of his ballpark. And so, Governor, I want to address it to you. As you see how things are going around the state, if there was a failure or a hiccup or a problem in any particular county, would you be willing to have the state step in to take over COVID fighting measures, similarly to the state stepping in when there are financial or academic problems in local counties? Thank you.
Kenny, I really am, am not dodging a question, because I just don't do that. I believe that I really believe in the local control, but at the same time, to answer your question, I think we've got to be, we've got to be smart about what we do. I mean, if we have something that's happening, in a county that is just spiraling out of control, or we have an instance that is just absolutely really not right, and it's really going the wrong way, well, of course we'll run to the fire and we'll try we'll try to give the local people knowledge, and first and foremost, we'll try to work with them. But if we have an uncontrollable situation, you know, are you asking me, are you going to sit on the sidelines and do nothing, Justice, and let something happen that was just totally out of control? Or are you going to do something about it? Well, I'm going to do something about it. You know, I'm going to try to do the right thing. And you know, I know that there was one board member that came up with something, you know, about testing, but now I think, you know, that they're in complete support of the testing, and you know, and absolutely all of us should know that, for crying out loud, you know, there is nobody here that's trying to do some sinister thing to be able to accommodate or move things around or make things look better than they are or whatever. Every single thing here is transparent to everybody. It's the way it's going to be. I mean, it's absolutely the way it's going to be. Now, we'll make mistakes. I mean, that's just all there is to it. But we're just not going to do something that is not right, knowingly that we know that it's not right. We're not going to do something and everything to the benefit of ourselves here or whatever it may be. And so if we got in a real situation in the county, and if it's a problem, and they're doing the wrong stuff, and I know it's the wrong stuff, well, sure, we're going to run to the fire. We're going to do something about it.
All right, thank you, Kenny. Next to Charles Young with WV News. Charles, we can't hear you. You might be muted. All right, I'm sorry. We'll try to work that out. How about Mark Curtis, Next Star? I see you there. Can you unmute and try?
Good afternoon, Governor. Good afternoon, cabinet members. Once again, I'm getting tons of calls, emails, and texts from parents in Putnam County who are concerned because they're having a big outbreak in the middle and high school there. They were under the impression that when students returned to school, they would all be temperature tested or have their temperature taken as they walked into the building. And they're telling me that's not happening, with the exception of pre-K. So I'd like to get the governor's reaction to that, and also ask Dr. Amjad if it is wise and should they be taking temperatures of everybody coming in every school.
Dr. Amjad or Secretary Crouch, somebody's going to have to answer that other than me.
I can answer. Yeah, sure. I can answer that, Mark.
Okay.
That's not a routine recommendation per CDC guidelines. Now, I mean, a local school can make that decision if they choose to, Mark, but it's not a CDC recommendation to do that for children. So I'm not sure where their Board of Education on a local level has decided that. We've heard multiple decisions made at local levels, but it's not a CDC recommendation to check the temperature of children before they're entering the school system.
All right, thank you, Mark. Next to Taylor Stuck with the Herald-Dispatch.
Hey everyone, it's Taylor at the Herald-Dispatch. I was wondering if someone could provide an update of the situation at Bateman Hospital. I was wondering if there is an outbreak there, if contact tracing was done after the nurse that passed away from COVID, and if it was found if she got it at the hospital or somewhere else, if anybody else in the hospital has COVID. Just wondering for an update. Thank you.
Okay, Secretary Crouch, it's got to be you, sir.
Yes, sir, Governor. Yes, we do have an outbreak at Bateman Hospital. We're working with the local health department and our own outbreak epidemiologist here at the state level to make sure that individuals are isolated. We have right now at Bateman, we have 27 staff who have tested positive and 22 patients who have tested positive. We have developed a unit that is COVID positive only to make sure that those individuals are protected and are isolated from other patients in the facility. And we have a unit that is set up for individuals who might be exposed so that they are isolated as well. So the individuals who are positive, the staff are self-quarantined at home. And we're following this closely and having conversations with the CEO and the administration of the facility daily. And we can keep you posted on that outbreak.
Come back to me just one second, Jordan. You know, uh, let me just give additional assurance from the governor. You know, I know we have a situation at Bateman, and I get texts and everything in regard to Bateman as well. I think that from the standpoint of the DHHR and the local people and the CEO and all the people, there, that we're doing everything that we can, that we're doing it and doing it properly. However, I will give you my assurance that as soon as we're done here, I'm going to consult again with the National Guard and DHHR and amp up, our response from the governor's office to be able to absolutely be positive that we're doing everything we possibly can there. There's enough concern that we can do more, and if we can do more, I want to do more. So you've got my word that as soon as we get through here, and from the standpoint, I can just tell them right now, Secretary Crouch, Dr. Amjad, and General Hoyer, if you could make a double check, go there yourselves, and come back and report back to me one more time to make absolutely certain we're doing any and everything we possibly can do there, go do it. Because I get enough response, I get enough, and I'm dealing now with my gut, not my brain, and my gut tells me that even though we're assured we're doing everything we possibly can do, it seems to me like there's a possibility that we can do more. We're going to go try to do it.
All right, thank you, Taylor. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question about outdoor venues. I know the governor has signed an order that will allow outdoor entertainment venues to operate with a higher capacity now. I wonder if there's any consideration to moving that to high school stadiums where you could certainly socially distance, wear masks, and get more people than are permitted now. Governor?
Well, the size of the events and the things that people are doing are so different. I mean, there's situations where there's 50 people and they're going to set up in a 2-acre area and they're and listen to a bluegrass band or whatever like that. From the standpoint, Paul, of what you're saying, it's rock solid, great knowledge and good information. The problem that you run into is the obvious. You got to get permission to go through the school to be able to do it, and rent the facility and all that. The facilities are being used on and on and on and on and on. But the stadiums, if we had a situation to where we had a maximum of 250 people, and and the stadiums or 25%, whichever is less. In the stadium, we can surely spread out 250 people in a great big area in a whole lot easier way. You're dead on the money, right? It's just, and I would encourage that, if someone's going to have an event and they're going to have 250 people there, the stadiums are something they ought to consider. And so, contact the high schools, and it's surely a way to make it just one more notch safer, but there's a lot of complexities there too.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi, I'm passing along a suggestion from a reader, and I think I'll direct this to Dr. Marsh. The reader is suggesting another possible map tweak, and that would be for a county to qualify as green, it would have to be green under both parameters of the infection rate and the positivity rate. The reader thinks this might make the teachers unions more comfortable, and that's a political consideration. But I wonder if Dr. Marsh could address the overall possible or usefulness or lack of usefulness of making that green more stringent. Thanks.
Dr. Marsh, go.
So, David, I think that that there are a couple of issues that you're bringing up, which I think are really important, and the reader's bringing up. Certainly we know it's human nature to look at a color and go like, okay, it's green, I can just boom, go through. Yellow, I have to be a little careful. And then we have the gold and the orange and the red. You know, the way that we look at it from a medical standpoint or a public health standpoint is there's really two separate paths that we have afforded each county to be able to try to get a handle and improve and control the spread, reduce the rate of spread of COVID-19. And that's the infection rate and the percent positive rate. Initially, when we just used the infection rate, which didn't account how many tests were being taken, people stopped wanting to be tested, and we were just testing the sick. And we saw all the numbers that I talked about earlier go in the wrong direction. And then the governor really challenged us, and we got together. And that percent positive rate, I think, has been really effective in increasing the number of tests, allowing us to find some of these spreaders. And we've seen all of the numbers generally go in the better direction and the number of tests go up. And that has, I think, directly related to the schools' safety that we have seen so far. And I think it's important that these same guidelines in some way, shape, or form are in many states. Now, it's important to realize that that percent positive rate or the infection rate independently are being used by different states. And so they're each valid by themselves. Put together, it gives us a county an opportunity to get to a better color in a reasonable and real way to be able to, to have their county be safer. So for us, whether you're green or yellow or gold or orange or red, it does not remove the need to do exactly the important mitigation measures, those protection measures we've talked about, because this virus will spread in a blink of an eye, and you can go from green to red or orange, in a few days. We've seen our reproductive value go up and down. So I think from a human nature standpoint, I understand the impetus for the suggestion and the idea, which is reasonable, I think. On the other hand, though, the way we look at it is every color is just a reflection of what's going on that time, but it doesn't remove the need for us to be just as careful in a red county as a green county to continue to do the things that we know protect the spread of COVID-19, because if you don't, the green county will become a gold, an orange, and a red county. So I don't know if that helps or not, but I do understand the inspiration that the reader is giving, and I understand that from a human nature standpoint. But from a medical public health standpoint, the protection that we should do is the same no matter what your color is.
And I'd like to just add just one thing real quick, and that is just this. David, I always appreciate your questions. You've been really kind and really straightforward and everything. But with this, let me just say that if there is absolutely any political, ingredients that could come into play with any of this, I don't want anything to do with it. I don't want anything to do with it at all. This should have no political ramifications in any way. We should be doing everything we're doing to try to do the right thing for the people, and we've done that. And I can't see tweaking something at all that, from any political consideration, and I don't want to, identify that that's really what it is or whatever, but nevertheless, that's the way it has to be, and from the standpoint of, additional tweaks, they've got to be, they'll have to be more substantive to me to change anything else. And on top of that, though, we want to remain fluid. And the other thing we've got us to do is exactly what Dr. Marsh already said. It doesn't matter if you're green or you're red. You better keep your guard up. This thing's not away from us. You better keep your guard up. And so all I can do is tell you, and if you don't do it, well, then we all suffer the consequences. And so, but I can't imagine us not doing it, if we know we have lives in our hands. People die. People die. I mean, West Virginia, people die if we don't do our part. And so we just got to do our part.
All All right, thank you, David. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I think on Monday we talked about the need for more federal stimulus funds, particularly to help people who are having difficulty paying rent or mortgages. According to the auditor's office, the cash balance in the CARES Act as of today is over $983 million. So even if you back out the money that we've parked for the Workforce West Virginia future payments, isn't there at least a couple $300 million that could be used to assist these folks?
Okay, well, Phil, I want to follow up on what you're saying. I can't. I don't know exactly how the money has gone out, and everything from the standpoint of what's going on, but I do know this, that Phil, if you'll just look about it, and I said this last night, but if you'll just look, when we got the $1.25 billion, we were basically awarded a fourth place best in the country as far as getting money out. From a standpoint of bucketing the money on where the money is supposed to go, we have done that, and I'll miss something, but I'll try it one time real fast. We sent $10 million for the Fairmont Hospital, $25 million to the public service. Please, forgive me if I missed something, but $50 million is sitting there to go to broadband. $150 million was set aside for small businesses. $200 million was set aside for our cities and our counties. Then $278 million was set aside to replenish our unemployment fund. Now we've got to do that for sure. And in addition to that, there was $400 million that was set aside as an unemployment reserve to get us to the end of the year. Now, I don't think I've really missed anything right there in the beginning. Now, what has really happened is just what I've said over and over. We've done better than what we thought we were going to do. So that makes more monies available to us. Nowhere close to anything like $900 million. I mean, I don't know where we come up with this stuff, but absolutely, if we just take one thing, the unemployment, reimbursing of the unemployment fund of $278 million off $1.25 billion, you'd almost come to your number with not a dime gone out, which is crazy. That's, that is distorting the numbers. But with all this being said, if you'll go through just what I just named, you come to a net balance of zero. We really absolutely would be silly if we absolutely have to send $1 back to the federal government. No way, no way. Now look, I'm a numbers guy. Now in this, what happened is we had our small businesses, the applications of our small businesses were not anything to approach $150 million. So we've got extra money there, don't we? Then we've got extra money with our unemployment reserve of the $400 million. We're not going to need all of our extra, our money for our unemployment reserve. So what did we do? What did we do right off the get-go? What we did is we had a need to do additional testing and to ensure that we had the proper PPE for our schools. So we set aside $50 million out of the unemployment reserve, lowering that to $350. We took 50 and put it over into the PPE and the testing, of our, of our schools, our K through 12. Now, in addition to that, a couple of things that I missed when I went through it the first time is we had our medical access roads. We had areas across our state where people, if they had an emergency, if they had a real problem, they needed to be able to get to our hospitals, and we could use some of the dollars. We vetted it completely. We could use some of the dollars to fix our roads in our areas where they were medical access roads. We put $50 million over in that. The only other two things we had was we replenished 57 million of the dollars that we had sent out in the state, and we replenished $21 million of monies that in the governor's contingency fund, where I sent out, as an example, 100,000 to each and every one of our counties. That was 5.5 million. Then in addition to that, I sent out, I don't know, almost all the balance of the monies went to the National Guard for all the different supplies and the labor and everything that we were paying there. So really at the end of the day, what do you come to? You come to this. There is no pet project. There is no hoarding of the money. There is no, where justice has kept the money back and not sent it out. Craziness, total craziness. There is no pet justice project, complete craziness. Absolutely, at the end of the day, what there is justice doing it in a business-like and a good, sound manner, and that's what I've done.
All right, thank you, Phil. Next, we'll go to Charles Young with WV News. We'll try again.
Hi, can you guys hear me this time?
We can. Go ahead.
Alrighty. I know that when Mon County was kind of the problem area of the state, we were able to attribute that to younger people going to bars. When it was the southern portion of the state, we said it was due to out-of-state travel. Do we know what is causing this uptick that we've seen recently in the north central West Virginia region of the state? Thank you.
I think somebody from the medical team is going to have to answer that.
Well, I'm happy to start, and then maybe Ein, you can add in if that's okay. So, Charles, thank you for the question. I think that the more we are going in this pandemic, the more we're recognizing that, there may be a few places like Mon County, as you suggested, where we can do epidemiologic contact tracing and identify very clear connectors that drive the number of cases that we see. And for Mon County, that was the bars. And we know in neighborhoods or in counties that have, colleges and universities around the country, we have seen some spike in the number of cases in this population. But what we see across the state of West Virginia is we see a variety of different age populations now becoming infected with COVID-19. And as we've talked about, the small gatherings, the people coming together, the fact that perhaps some people are tired of really either believing that this pandemic is real or that it really does, serve much risk to them. And so I think that the protections and the social situations, we talked about the role of small family gatherings across the country driving this. And I think that we're seeing a lot of these smaller outbreaks in groups that are all connected together. And one of the keys is that as we get more people infected, then we do have more people that can become super spreaders. And we know that by having larger events that happen, that we would gather more people at, we can find super spreading events. So I think that the real truth is that instead of being a single definable source, there's a lot of things that are adding up to drive COVID spread in parts of our state. We know in some counties we've seen outbreaks in churches. We've seen outbreaks in sports teams. We've seen outbreaks in fire departments and et cetera, et cetera, et cetera. But these are not as big of events as we've seen, say, in Mon, or we've seen, say, in Randolph County with Huttonsville, or other places in congregate settings where we've seen a lot of cases that have been concentrated together. And it just reinforces to me this need to test, and to make sure that we are really aggressive in keeping up our guard. So, Ein, I don't know if you have anything else you want to add.
Just a little bit that I did go up to Doddridge County and I spoke with Ora Ash, who's on the Board of Health, and he did mention that a lot of people were not privy to wearing masks, so they were working on that mitigation effort with a lot of the community there. So that area there, we're trying to encourage mask use and social distancing, a lot of testing where it's not being done in those areas. So they have ramped up testing efforts in those communities. So those counties up there, we're trying to encourage masks, testing events, but that's a little trend that we noticed up in those counties. But that's all I had to add. Thank you.
All right, thank you, Charles. Governor, I'll turn it back to you.
Well, I'll just end by just saying 2 or 3 things. One at the end, I'd hope everybody will dial into me and listen to me, but I want you to listen to all this. But special thanks again to the National Guard and all they're doing in regard to all this testing and sanitization in general. Way to go, and way to go with all the troops and everybody that's doing a great work there. And another special thanks go out to all those workers, not just, the people that are the recipients by any stretch of the imagination, but all those workers that are at our food banks. What an incredible job you're doing, and it's a real pleasure for us to be able to participate with this $1 million to go to our food banks today. We got to make sure that our people are fed and everything, and what an unbelievable service you're doing, and honestly, right on the front lines again. I mean, are you not? All the people that are coming in, I'm sure some of them have come in and have COVID, maybe don't even know it. You're standing there doing your job and helping, and really many volunteers. So thank you so much. And I want to again emphasize that from the standpoint of Bateman, in my gut, I just feel like we can do more. And we'll be running to that fire, and we'll run to that fire today. That's all there is to it, in a bigger way than we have been. And I hope and pray everything's been going right, but at the same time, if it's not, we want to do better. Now, last thing I'd have to say to you is just this, because a lot of people have brought this up and said, well, Governor, we think that you've got a bunch of this CARES money and it's just sitting there and everything, and who knows what in the world they're going to come up with next that I'm doing with it, but nevertheless, here's one thing that I want to assure you. And I'd like you to ask yourself just this question. Who has applied? Who has applied under the guidelines for CARES money that we have not sent the money to? I mean, for crying out loud, we plead every day for our cities and our counties to apply. We plead every day, or pleaded every day, for people that had 1 to 35 employees, please apply. We knew that a company that had 200 or 500 or whatever employees, that if we sent them $25,000 or we sent them $10,000, it'd be a bump on a dinosaur. I mean, it wouldn't even matter to those companies. Those companies were already involved in the PPP program and everything that came out. We knew that. So what did we want to do? We wanted to help the 1 to 35. And then we went back and said, you don't even have to have the 1. If you are a sole proprietor and you're gaining your employment dollars through the profits of or you're gaining your income, your revenue through the profits of your company, you apply. And so we sent out monies to all them. Now, in addition to that, what we have done is we have managed your money. We have managed your money that the federal government has given us in a proper way. We're going to continue to do just exactly that. But at the end of the day, we're going to some way, somehow, disperse every last dollar of this CARES money before December the 30th. One way or another. So from the standpoint now of the cities and the counties, continue to apply. From the standpoint of anybody out there and everything that you can find a way to qualify, apply. From the standpoint of the grants, keep working the grants. Keep working the grants. I truly believe that there'll be another stimulus package come. It'll come, I hope it will come almost immediately. And if it does come, with it will come more guidelines, more things will happen. It may very well be that we get more CARES money that come, and it may very well be that they extend the deadlines to where we'll have longer than past December the 30th. And you may think, well, Justice, it's December the 31st. No, it's not. It's December the 30th. So I don't know why they did that, but they, everybody must be planning on having a New Year's Eve celebration or something. I hope it's a celebration of the vaccine. So with all that being said, that's all I got today. Again, special thanks to the National Guard and all the food bank workers and everything that do the great work every day. And God bless each and every one of you.